From today, children who are a COVID-19 close contact in primary school will no longer be required to restrict their movements if they don't have symptoms. Automatic contact tracing for all close contacts in childcare facilities and primary education will also be discontinued. For more on this, we're joined by the HSE Chief Executive Officer, Paul Reid. Paul, thanks indeed for talking to us. Just talk us through those changes that are happening today.
Good morning, Shane.
Morning.
Yeah, I do appreciate it's significant changes for schools, again, making more adjustments in terms of testing, contact tracing. So from today, children from 3 months up to 13 years of age will no longer need to isolate or go for contact testing if they've been identified as a close contact in the school setting. It does still apply if there are symptomatic, so that's if they're asymptomatic. If they're symptomatic close contacts, they will go forward for testing. So I fully appreciate heading into this COVID and all the changes we all had to make in our lives, particularly in schools and school children and parents and principals and teachers. It is a different phase we're in now. We're in a phase now where we're moving towards, I guess, a transitionary phase. It's not eradication of the virus by any stretch. But it is a different phase.
Some experts, I'm sure you've heard them, we've had them on the show ourselves, saying this is too soon, it's the wrong decision, it's premature.
Yeah, and fully respect all those views. I mean, the one good thing about Ireland and our response to COVID is there's been many expert people giving their views throughout, and these things are never binary, but from our perspective in the health service, what we do have to do is take decisions based on the balance of the risks presented to us. And on the balance of the risks presented to us, what we are seeing is much lower levels of transmission in schools. It was around 15-16%, now less than 5%. But more importantly, children not predominantly becoming sick or indeed for the transmission outside of the school setting. So, the balance of risk for us is that having, significant numbers of children, sometimes between 10 and 12,000, out of school, missing out on major elements of their educational, social well-being generally, it's much higher risk.
So when ISAG, the zero COVID years, say we don't have evidence that case numbers are dropping in school, you say we actually do have that evidence.
Yeah, I think there's two pieces of evidence that we would have moved forward on this decision based on. Firstly, the transmission levels in school being much lower than they are in the community. So, for example, in the household setting, children can be up to 25-30% positivity levels, but in the school are much lower, as I said, just about 5%. But equally, the numbers of infected children then within the school settings are relatively low. So, that's the kind of evidence that we are seeing. We've been monitoring for it since the schools have returned. And as I do mention, that's what we have to weigh up on the balance of risks that we're seeing.
Okay. The more general standing down of routine testing and tracing for close contacts, I think, is it October 22nd? I think is the date that's going to kick in. Again, just talk us through the reasoning behind that. Some people will say that's too soon. Sorry, and I know this is a decision made by NEFIT, not by the HSE in particular, but I'm just curious your take on it.
Yeah, and in fairness, we will monitor it all the way up to that phase. What we are looking at and planning for is what I'd call a transitionary phase, where you've heard many experts talking about moving from pandemic management to an endemic and what that looks like differently. So what we are seeing is a kind of moving from measurement of infections and the number of infections to move into how we monitor sickness in our communities, as happens with many other infectious diseases. So from a health perspective, it is looking to assess symptomatic people and identify symptomatic people, obviously. We will continue to test for outbreaks and continue to do kind of general surveillance of what we're seeing. But it is moving from a kind of infection measurement to clinical assessment of sickness in the community. And part of that transition is to ensure that we do and give the full weight to non-COVID health services as well. So, that's a big issue for us overall in society.